Welcome to the Medical Association of Georgia's award-winning Top Doc Show. With more than 8,000 members who care for patients in every specialty and practice setting, MAG is the leading voice for physicians in Georgia. Go to mag.org to join MAG if you're a physician in Georgia. And thanks to MAG Insurance Agency for its support as a sponsor.
Welcome to the Medical Association of Georgia's award-winning Top Doc Show. With more than 10,000 members who care for patients in every specialty and practice setting, MAG is the leading voice for physicians in Georgia. Go to mag.org to join if you're a physician in Georgia. I'm Jeremy Bonfini, the Executive Director and CEO of the Medical Association of Georgia. Today we are joined by Dr. Heather Gatcombe, a board-certified radiation oncologist at Winship Cancer Institute of Emory University. She serves as Vice Chair of Community and Belonging in the Department of Radiation Oncology and sits on the Board of Trustees of the United Mitochondrial Disease Foundation. Dr. Gatcombe brings a unique perspective as both a physician and the parent of a child with mitochondrial disease. Welcome, Dr. Gatcombe.
Thank you. Thank you for having me.
Well, it's a very interesting topic, and we have a number of questions. We are, of course, interested in educating physicians across the state of Georgia and the country on mitochondrial diseases. So please start us out telling us, what are mitochondrial diseases?
Wonderful question. So mitochondrial diseases are diseases that affect the DNA of either the nuclear DNA that you inherit from both parents or from your mitochondrial DNA. It's a separate circular DNA that's inherited from your mother. And as you may know, there's mitochondria in every cell of your body except for your mature red blood cells. So it could potentially affect any organ in your body.
Well, great. Well, how common are mitochondrial diseases, and why are they often missed or misdiagnosed?
About 1 in 4,300 people have a diagnosis of a mitochondrial disease, but we think the true incidence is actually much higher because of the number of undiagnosed patients that are suspected in the community. The risk of having a mutation on either your mitochondrial or nuclear DNA is about 1 in 250. So 1 in 250 people are carriers. It doesn't mean they're going to develop a mitochondrial disease, but they could pass on that mutation to one of their children.
You mentioned earlier that any organ can be affected, but what organs are typically affected, and what are the classical clinical features?
So the organs in your body that require the most energy consumption, your brain, your nerves, your skeletal muscle, and your heart muscle are most commonly affected. So often in most mitochondrial disease, one of those organs may be affected at some point in someone's lifetime. And for many people, it depends on the severity of the mutation. So there are 37 genes on your mitochondrial DNA, but there's over 1,500 on your nuclear DNA that you inherit from both parents. And a mutation, either one of those can cause a mutation. And depending on the severity of the mutation, it can present at any point. So very severe mutations can affect children. And severe mutations can actually lead to death in utero or in infancy. But patients can actually still present throughout their lifetime, so 40s, 50s, 60s, 70s. And there was actually a large survey that was published about 2 years ago. It's called the Odyssey 2 study that looked at patients in the United States. And they found a large percentage of people received a misdiagnosis. They had a delay of up to 5 to 10 years before they received the correct diagnosis. They could also receive misdiagnosis of GI or neurological malignancies, autoimmune or rheumatologic diseases, and chronic fatigue syndrome and fibromyalgia was also a very common misdiagnosis in patients who are eventually found to have mitochondrial disease.
You mentioned inheritance. What patterns do mitochondrial diseases follow?
So if it's caused by a mitochondrial DNA mutation, it's a maternal inheritance pattern, being inherited from your mother. But if it's a nuclear DNA mutation, it would follow Mendelian inheritance, and it would be an autosomal recessive pattern. So you would need to receive the gene from both parents.
I see. So when should a clinician suspect mitochondrial disease?
This is where it gets difficult because, as we said, it can affect potentially any organ system in your body. But if you see a patient where multiple systems are affected, especially three or more, and the patient doesn't have any other known syndromes or diagnosis causing that, you should be suspicious for mitochondrial disease, especially when the heart or the brain is affected. If a patient has a family member or patients with their family members either had a heart attack or early cardiac death, or family history of diabetes and hearing loss, those two together, especially at a young age, is also suspicious for mitochondrial disease. You should also be suspicious if you have a patient with a history of stroke-like episodes, but when you get imaging, the abnormality is not in a vascular pattern. It's called a metabolic stroke, and it's not caused by a hemorrhage or a bleed or a blood clot, but because of the energy required of the brain can cause a metabolic stroke.
Right. So how do you currently approach diagnosing mitochondrial disease?
So if you're suspicious, you should send them to a mitochondrial disease expert. And in the state of Georgia, we would send them to a medical geneticist for genetic testing. So genetic testing is the gold standard for diagnosing mitochondrial diseases, but unfortunately, most patients aren't offered these tests. And there are actually ways to access them free of charge through the United Mitochondrial Disease Foundation.
Right. And that's very interesting. MAG has been active on supporting genetic testing coverage from insurance companies. So I imagine that comes as a great comfort to families impacted by mitochondrial disease. How reliable are biochemical tests in establishing the diagnosis?
Not at all. So before we had gene sequencing and the ability to do genetic testing, um, decades ago, we've only known about mitochondrial disease the past few decades. So they were
Mhm.
first diagnosed in 1988 is when they found the first mutation, actually here at Emory in Atlanta by Dr. Doug Wallace. So initially, before we had universal genetic testing available, they relied on blood tests. Maybe the lactic acid was high, or they would do biopsies, muscle biopsies, tissue biopsies. But it really, now that we have genetic testing, that is the gold standard. So we can't rely on blood tests because that does not rule in or rule out mitochondrial
Right.
disease.
So once you have a diagnosis, what treatments are currently available?
That's an excellent question. So 6 months ago, I would have said there are no FDA approved treatments for mitochondrial disease, but there are actually now two FDA approved treatments within the past few months. The standard of care is optimal medical nutrition. So there are actually currently bipartisan bills that have been introduced in both the House and Senate supporting the Medical Foods and Nutrition Act. Because patients with certain metabolic and mitochondrial diseases aren't guaranteed coverage through their insurance coverages. And I'm sorry, I went a little bit off topic, so I
No, it's
apologize.
great. It's what
But
we
this
deal with every day.
the standard of care is optimal medical nutrition. For our child, they did a skeletal muscle biopsy and sent his tissue for analysis to see what wasn't working well and what complexes in the oxidative phosphorylation cycle were not working well. So based on that, he's prescribed specific amino acids and vitamins to help push that process forward. Um, Many of us may not remember the Krebs cycle from medical school. For me, it's over 2 decades. But this is where it's very important to know exactly where the mitochondria are not working well so the patient is supplemented adequately. It's also very important to avoid metabolic stressors. So a state of infection or fever or fasting or anesthesia can actually cause a metabolic crisis and cause patients to have symptoms when they may have not had symptoms before. So we have to be very careful with surgical procedures. Many patients with mitochondrial disease cannot fast before a procedure.
Interesting. You mentioned food and nutrition. What other lifestyle modifications can help patients manage mitochondrial disease?
So, in addition to optimal nutrition and trying to avoid metabolic stressors, if patients are able to exercise, we recommend both aerobic and strength training exercise because it can actually increase the number of mitochondria. They're actually doing studies at CHOP for patients who can't do active exercise, but doing passive exercise. So that is important.
Very interesting. This is obviously a very new space in medicine. It's an even newer space as far as treatment. What resources are available for patients and families seeking information and support?
So I would recommend going to the United Mitochondrial Disease Foundation website. They have resources for both clinicians on how to diagnose, who to refer to, how to refer patients for free genetic testing, but also for patients. And they have support ambassadors. So patients can either call or access support ambassadors online. MitoAction is another wonderful support nonprofit. I would start there.
You mentioned it earlier, and I want to provide it as a follow-up question. Uh, this is a new space, new treatments. Is insurance catching up?
That's an excellent question. So for at least for our child, we had genetic testing denied at multiple points on our
Mhm.
route. And at least for our son, his genetic testing was negative for 5 years because they
Wow.
hadn't found the mutation yet. This is a new space and they're finding new mutations that can cause a pathogenic mitochondrial disease. And so we're always finding new ones. So at least for us, genetic testing has been an issue, and that's why free genetic testing is so important. For us, none of his medical nutrition supplements are actually covered. We pay a couple $100 out of pocket a month per month. So that is an issue nationwide.
Mhm.
We can go more into that if you'd like.
Oh, absolutely. We have time. You've been very on the point in addressing the question, so please continue.
So it's very inconsistent on a state by state basis how they mandate medical coverage for medical nutrition. So this is important for inborn errors of metabolism, such as for patients with PKU, patients with mitochondrial disease, different malabsorption syndromes. And so based on what state you're in, it may or may not be covered. And patients can spend hundreds to thousands of dollars out of pocket, especially if you need like a low protein medical formula that may or may not be covered. Or even if it is covered, especially in the state of Georgia, it's covered under Medicaid. But once you hit 22, you lose coverage. There is a special fund that was set up in Georgia to help fund that gap, but it doesn't include everyone who needs medical nutrition in the state. And that's actually run by Dr. Singh at Emory. She runs a camp for children with metabolic disorders, and she's doing some great things. But we have some gaps that we need to fill for patients in the state of Georgia and
Great.
throughout the
Well,
country.
absolutely. Well, we really appreciate the clinical insight as well as understanding how insurance is handling treatment for our patients, payment for that treatment. It's really important we remember that there's always an advocacy angle to healthcare, advocating for your patients within the healthcare institutions, but also advocating for them down at the Capitol or in Washington, D.C. So, Dr. Gatcombe, thank you so much for your time, your insights. It's been an excellent interview. I want to thank our audience for watching this episode of Top Docs. Please share this program with your colleagues, family, and friends. And remember to follow Mag on Facebook and Twitter. And don't forget that you can also get past episodes of the show at mag.org/topdocs. From everyone at MAG, we look forward to catching up with you on our next episode of Top Docs. Thank you so very much.
Thank you.
Thanks for watching this episode of Top Docs. Please share this program with your colleagues and family and friends. Remember to follow MAG on Facebook and Twitter. And don't forget that you can get past episodes of the show at mag.org/topdocs. From everybody at MAG, we look forward to catching up with you on our next episode of Top Docs.